Hi there, my name is Joshua Manalese, a third year nursing student. The topic that I'll be covering is moral distress within the intensive care unit. So, what is moral distress? Moral distress has been defined as when one knows the right thing to do, but institutional constraints make it nearly impossible to pursue the right course of action. However, this definition has now been expanded as the painful psychological disequilibrium that results from recognizing the ethically appropriate action, yet not taking it because of such obstacles as lack of time, supervisory reluctance, and inhibiting medical power, structure, institution policy, or legal considerations. There are several factors that may contribute to the development of moral distress of ICU nurses. These include various aspects of clinical situations, internal constraints, and external constraints. Examples of what may cause moral distress from clinical situations include futile or ineffective treatment, insufficient pain relief, providing false hope to patients and their family members, not granting patients' wishes, and working with incompetent team members. Internal constraints refer to a nurse's inability to preserve their mental and emotional health when caring for difficult patients or exposed to difficult situations. A nurse may lack confidence, feel fearful, unable to cope, and conflicting ideas with own spiritual beliefs. External constraints refer to policies and aspects of the work environment that prevent proper care to be given. For instance, a lack of cooperation between colleagues such as a physician and a nurse who share responsibility may leave a nurse powerless, and lack of effective communication. So, why is it a significant problem to contemporary nursing practice? In today's contemporary society, moral distress is widely acknowledged as a threatening aspect to patient care and safety. This is particularly a problem within the intensive care unit due to its very stressful and demanding environment where there is high patient mortality and morbidity, regular exposure to ethical dramas, and tense environment. According to Miller and Moss, moral distress is found to affect up to 80% of critical care nurses. If moral distress isn't mitigated sooner or its significance isn't addressed further, this may cause nurses to further feel as though they are voiceless or unable to make ethical decisions regarding a patient's care. The long-term effects of continuous exposure to ethical dilemmas may cause ICU nurses to further feel powerless and thus may potentially force the nurse to remove themselves or avoid morally challenging discussions. Additionally, other long-term consequences of moral distress includes withdrawal, emotional exhaustion, depersonalization toward patients, and other symptoms of burnout syndrome. Moreover, the effect of moral distress can also impede an ICU nurse's ability to provide safe and quality care and hinder their ability to carry out their responsibilities as a nurse. So, what is currently being done about the problem? Though moral distress in healthcare has been identified as a growing concern, there is still a lack of literature surrounding the topic of moral distress, and thus there is a lack of suggested strategies to combat moral distress in nursing. This may be due to the lack of clarity and theoretical confusion regarding the concept of moral distress. Due to the lack of conceptual clarity and theoretical confusion of moral distress, this has inevitably hampered action on moral distress in education, policy, and practice. So, as a future new graduate nurse that may encounter morally distressing situations in the critical care environment, I believe it is imperative that I familiarize myself with the registered nurse standards, code of ethics for nurses, and code of conduct for nurses. By understanding these frameworks and my obligations as a new graduate nurse, this will give me the confidence to be able to tackle ethical dilemmas. As nurses, it is an obligation to abide by these frameworks to upkeep patient safety. In regards to the registered nurse standards, The most relevant registered nurse standard that new graduate nurses should refer to when dealing with morally distressing situations is Standard 1.5, where it states, uses ethical frameworks when making decisions. In this case, new graduate nurses should then refer to the Code of Ethics for Nurses framework regarding decision making on morally distressing situations. In reference to the Code of Ethics for Nurses, Value Statement 1 states, Nurses value quality nursing care for all people. This value statement involves nurses accepting accountability for the standard of nursing care they provide, helping to raise the standard of nursing care, and taking action when they consider, on reasonable grounds, the standard of nursing care to be unacceptable. This includes a responsibility to question and report what they consider, on reasonable grounds, to be unethical behavior and treatment. Another aspect that may be useful as a new graduate nurse is reflective practice. A study conducted by Caldwell and Grobel 2013 states that nurses who reflect on their practice enhances nursing care, having a better understanding of their actions, which in turn develops their professional skills. Therefore, when exposed to a morally distressing situation, it may be useful to reflect on what made the situation morally distressing and identify why it made it a stressful situation. It would also allow me to think of how to approach the situation better in future encounters. Lastly, when exposed to a morally distressing situation as a new graduate nurse, I believe it is vital that I seek mentorship or guidance at work. New graduate nurses must speak up about moral distress and how to develop and build their moral resilience. Remaining quiet and not addressing the issue can cause great harm mentally and emotionally. So, effective leadership in regards to this contemporary issue in nursing practice can ultimately help mitigate the development of moral distress in nurses. Currently, there is still a lack of examined strategies to prevent or treat moral distress in critical care nurses. However, a study conducted by Miller and Moss 2016 shows that they have found potential strategies that may prevent or treat critical care related moral distress. They have been categorized into three groups that include educational interventions, interventions enhancing the ICU environment, and interventions focused on helping individuals cope with their work environment. Potentially, the combination of all three interventions that address the ICU environmental culture and the nurse will be more likely to successfully prevent and treat moral distress. Educational interventions on moral distress, such as ethics, education, may be effective in providing nurses the knowledge and resources to be able to make ethical decisions and develop coping mechanisms to combat symptoms of moral distress. Education on ethics may boost the confidence and courage of nurses and enhance a nurse's ability to cope with ethical dilemmas. An example of this would be doing self-directed learning or attend workshops regarding the topic of moral distress. Enhancing the ICU environment can be achieved through various interventions, such as establishing debriefs after a distressing event, ethics rounds with a multidisciplinary team, introducing ethics committees, and involving nurses in policy making. As a leader, enhancing the ICU environment can also be achieved by creating a supportive environment. For instance, reaching out to fellow colleagues who may have just had a distressing encounter with a patient or their family. Helping individuals cope with their environment can be achieved by introducing practices that promote resilience. Some practices include meditation, self-reflection, developing greater self-awareness, and developing stronger communication skills. Providing nurses these coping strategies can potentially reduce symptoms such as compassion fatigue, traumatic stress, and burnout. Thank you.